So here we go. I've got a mind map for you, but I won't dwell too much on it. So really the challenges, the clinical perspectives, I'm going to sort of give you a few thoughts on. I thought I'd just share this with you. This was in the Times this week. And to some extent, we need to be a little bit like Mr. Blair in terms of making this agenda go forward. He's very inventive and has a very good network, and we need to make use of our network to make this project move forward. I was going to tell you a little bit about the scale of the problem. I mean, the NHS is an amazing and an incredibly productive enterprise. There's a huge degree of activity. It serves millions of people every day. It has a huge budget, as you know, but there are some challenges. The long-term conditions that affect about 15 million patients. And do you know what proportion of patients take their treatment? 50%. So whatever you do, half of it is actually made use of. So you haven't convinced them, they don't understand what you're saying. There are some real issues there. 80% of the health resource is taken up by long-term conditions. So perhaps £40 billion is taken up by providing long-term condition treatments, which only a proportion of it is used. I'll give you another figure. What proportion of patients have an untoward event, particularly in hospitals? 7%, did somebody say? Well, it's actually 1 in 10, a minor untoward event, and 1 in 300, a serious untoward event. You can have the wrong leg taken off, or you might die. So these are serious. Healthcare encounters are really serious and consequential. And the volume of activity that takes place is very substantial. And the cost and the spend on healthcare is enormous. So any small things we can do, if we can improve the interaction by 1/4% or by 1% and multiply that over across the total activity of the NHS, we can make a real difference. So that's what we're about. It's about the clinical consequences and what we can do about patient experience to drive up the clinical consequences and the quality of the clinical consequences. We've got a workshop, so that's going to come in a moment, and we'll discuss some practical things in that. This is just some of the figures that I've sort of mentioned to you already. We do have some bureaucratic structure. There are some challenges. It's not a straightforward thing, but we can use small examples, and I'll share with you one small example about some of the things that I've done. I've been interested in patient education and so on since 1995, and been doing patient services since 2005, and there have been various iterations, and I can show you that. And really what I do is briefing and debriefing the whole team before the start of each clinic and at the end of each clinic. And I'll show you some results in a moment. So this is the main thing I wanted to say. I'm sort of rushing through these things because I don't want to delay David, but challenges, there are some challenges. There is some lack of training, infrastructure, time, fear. We don't want to know what people might think about us. That just, there are sort of hesitancies about really asking people to genuinely feedback to you and then make real use of that. It hasn't had a big profile. I think the time that David's spending on this, the GMC, yourselves, other interested parties, I think that's changing all of that, and possibly linking remuneration of clinical activity with patient feedback. I think that's going to change all of that. But there are some significant challenges, but they're not insurmountable. So this is one of the things that I've tried to institute is have systematic feedback. So every patient that comes to my clinic has a chance to feedback. Every patient. And not necessarily everyone gives, but I think we've got 80-90% of people, every clinic, we want feedback. And then we look at that feedback at the end of each clinic, and we have a real-time sense of what's going on. And if there are things that we haven't done. So yesterday somebody gave feedback, and they said they didn't. There was something about not having things explained clearly to them, and we got fair rather than excellent or great or whatever it was. And it was someone who was hard of hearing, and I hadn't spent enough time looking at them, and they didn't pick up necessarily. So every microscopic thing that you can do, you can get some feedback on, you can make use of. So in the next clinic, you pick that up. There's a few different things that we've done. I probably won't have time to go through all of them now, but having that sense of wanting to really understand and learn the patient's perspective and to make use of their comment and to put that into practice and to change for the next clinic or change for the next patient, I think that's what we're about. And to do this sort of stuff doesn't take much time. The patients get a questionnaire before they come in. It takes a few moments for them to fill in, and they then have a consultation, and they get a questionnaire, and they leave it at reception before they go out. They do it anonymously. It takes me a minute and a half or 2 minutes to brief the team in the start of the clinic, and about 2 minutes to go through the questionnaires and just the general feedback from the team at the end of the clinic. And we just do this all the time. So, I mean, this is just an example of the kind of feedback that we got. This was presented at the clinical governance. And so in the small panel inside the graph is the quarterly feedback that MTW does. And it's actually very useful. It gives you some idea about patient understanding about different aspects of the service that we're providing as a trust. But to me, as an individual, I have no idea what happened. I have no idea whether it was good or bad or whatever. And it doesn't matter whether I was good or bad yesterday. I want to be good or bad. I want to know how good or bad I was right now. And every time I see someone, I want to be able to say that I've confidently done my utmost, and my team has, to deliver the most appropriate service and care and experience for them. So these are some of the things that we get back, and we've acted on them, and we instituted some change in practice. So we're making lots of small changes all the time. I mean, music in the waiting room, a lot of these things don't take much time. It takes a little bit of sort of resourcefulness and a different sort of approach to things. But any feedback you get is like the most amazing thing they can give you. They're gifting you with their insight, and we've got a chance to do something about it. And, so you involve the rest of the hospital, or you involve other people within the enterprise. So I think what I'll do, I'll put the presentation on the website. But the questionnaire that we use, and it's very straightforward to do, and I think I'm going to stop there actually. Well, I'm delighted to be able to share with you what we do in the clinic in Pembrey. All the patients get a questionnaire before they come into the consultation room, which gives them a chance to say a few things about their symptoms and so on. And then they have a consultation. At the end of the consultation, they get a chance to summarise their experience of having attended the clinic and different aspects of it. And we then look at that feedback at the end of the clinic during the debrief with the staff within the department. And are there any learnings that are made available, any learnings that are usable immediately in terms of the running of the clinic and so on? We put those into practice at the next clinic, and we do the briefing and the debriefing and the patient feedback all the time. And really our target is to get feedback from every patient that we see, and to then work with the comments and the suggestions that they might have. Many times they may not have any suggestions, but when they do, we make use of them as immediately as we can. Now, the summary of this information is available in the PowerPoint, which is uploaded on the website, and you can run through them. If you have any questions or suggestions for improvement, please email. Thank you.